Welcome to Raaonline. I am Dr. Sukanya. I am a general physician in Chennai. We'll discuss macrocytic anemia now. So what do you understand by macrocytosis? So macrocytosis refers to RBCs larger than usual. That is, normal MCV by automated cell meter will be around 80 to 100. So the normal MCV is 80 to 100. So cells which are greater than 100 femtoliters are called as macrocytes. So how do you identify these macrocytes in the peripheral smear? Is the normal RBC diameter in the peripheral smear is around 7 to 8 microns, which is approximately the size of the nucleus of the small lymphocyte. So if you see in the backdrop, you have a peripheral smear picture. So this is the neutrophils and these are the small lymphocytes and these are the RBCs. So this is the nucleus of the small lymphocyte. So you compare the RBC size with the nucleus of the small lymphocyte. So if you see here, the RBCs are larger than the nucleus of the small lymphocyte and therefore these RBCs are called macrocytic. Okay. Now what are the causes of macrocytic anemia? So basically you classify macrocytic anemia as megaloblastic anemia and non-megaloblastic anemia. So megaloblastic anemia, what are the causes of megaloblastic anemia? As we all know, vitamin B12 deficiency, folate deficiency, drugs which causes B12 folate deficiency and thiamine responsive megaloblastic anemia syndromes come under megaloblastic anemia. And non-megaloblastic anemia, the common condition would be alcoholism, chronic alcoholics, then liver diseases, reticulocytosis, because we know the reticulocyte diameter is larger than the mature RBC. So when there is reticulocytosis, as in case of hemolytic anemia, you have larger reticulocytes in the peripheral smear, which gives a macrocytic appearance to it. And hypothyroidism, aplastic anemia and myelodysplastic syndrome. So these are some of the causes of non-megaloblastic macrocytic anemias. Now we'll discuss in detail about megaloblastic anemia, which is what we commonly see actually among the macrocytic anemias. So before going into the detail of megaloblastic anemia, we'll just run through the erythrogenesis or the erythropoiesis which happens. So normally this is the normoblast, and from here as the cells mature, so as developing RBC precursor cells in the bone marrow mature, they divide rapidly and become progressively smaller. So from the normoblast to the reticulocyte, if you see the nucleus size, the nucleus shrinks, the nucleus becomes smaller and the cells also become more mature and smaller. And these are the peripheral blood, what you see is the erythrocyte. Okay, so this is a normal maturation process in the bone marrow. So in conditions in which DNA synthesis is affected, like in B12 deficiency, folate, because B12 and folate is essential for the DNA synthesis. So in conditions in which the DNA synthesis and the cell division is impaired, you have a dyssynchrony between the nuclear and the cytoplasmic maturation. So what happens is cytoplasm matures, but the nucleus doesn't mature. The nucleus remain large, immature, the nuclear chromatin remain immature. So you have an immature nuclei, cells with large cells with immature nuclei and relatively abundant cytoplasm, and these cells are called the megaloblastic cells. Okay, so the ultimate basis for production of megaloblast is inadequate conversion of deoxyuridine to thymidine, which leads to slowing of the DNA synthesis and there is delayed nuclear maturation. So this is megaloblast. It not only affects the RBC lineage, it also affects the leukocytes, it also affects the platelets. Now what are the hematological features of megaloblastic anemia? So in the peripheral smear, the two valuable findings you see is neutrophil hypersegmentation and oval macrocytes. Okay. So what is this neutrophil hypersegmentation? This is one of the most sensitive and very specific, in fact, early sign of megaloblastic anemia. So normally the nuclei of the neutrophils, segmented neutrophils, they usually have some 5 lobes. In megaloblastic anemia, the neutrophils will have more than 6 or more lobes may be detected. And these neutrophils are called hypersegmented neutrophils, and they are the first hematological abnormality to appear once a megaloblastic state develops, and in fact it persists even after institution of therapy. It can persist for even 14 days after specific therapy you give. And the main product of megaloblastic erythropoiesis is the macrocytic erythrocytes, as we already saw. And these macrocytic erythrocytes, they have a distant oval shape. So that is what we call as oval macrocytes. Such cells are well filled with hemoglobin, and often the central pallor is reduced or absent. So this is a peripheral smear picture of a megaloblastic anemia. So here you are able to see the hypersegmented neutrophils. Neutrophils with more than 6 lobes are called as hypersegmented neutrophils. And you have the RBCs which are oval in shape. So here you see a big macrocyte and oval cell. So oval macrocytes are seen which lack the central pallor. So this is a central pallor. These are some of the normal cells which have the central pallor. Whereas here the large cells, they lack the central pallor. So this is a characteristic peripheral smear appearance in a case of a megaloblastic anemia.